Hi, everyone, and welcome to the UCSF Neurologic Physical Therapy Residency. Thanks, everybody, for joining this breakout room. I'm Erin Hallett. I'm the interim program director for our neuro residency. I'm also the program coordinator for our acute care residency. So, a little bit of an overview about our program. We're a full-time program, 12 months long. Our start date is in the beginning of September of 2026. So, whatever that Monday is, the beginning of September, that's not Labor Day. We're based at UCSF Parnassus and our outpatient faculty practice at Bayfront. We offer one-to-one mentoring 6 to 8 hours per week, and that's just an average spread out throughout the whole year. We offer teaching in our DPT program, average again throughout the year, 3 to 4 hours. The main bulk of the teaching time is going to be in the fall and summer trimesters. There's weekly didactic instruction throughout the year, and that will be shared with your co-resident. On average, 30 to 32 hours of patient care, and we will be accepting 2 residents for the fall of 26-27 cohort. Some more details about our program. We're a multi-site neurologic residency program, comprised of rotations in acute care at Parnassus and outpatient at our faculty practice at Bayfront. We also offer a 2-week clinical experience at Zuckerberg San Francisco General Hospital, and that is focused on our neurotrauma, where we get our spinal cord injury and brain injury. In addition, you'll also have access to some clinical rotations throughout several of our multidisciplinary clinics here at UCSF. So ALS and neuromuscular clinic, TBI, neurorecovery, memory and aging, Botox clinic, health and wellness community clinic, MS clinic, balance and falls center with audiology, and then orthotics clinic as well. Here's a general overview of what the year looks like. So we separate the year into trimesters. So mentoring block 1, 2, and 3 that you see across the top. Our residents start at different campuses. So one resident will start an inpatient from September to December, where one resident will go to our outpatient clinic from September until April. But you see in the middle there, from January to April, our residents will overlap and get to treat in the same clinic. And then resident 2, once they've completed their outpatient rotation, they will come into inpatient in May. The coursework happens concurrently throughout the entire year, and that is an opportunity each week for the co-residents to be together. Where you see the stars and X's, those are your live patient exams and written exams, so those happen at the end of each trimester. Within these blocks, you'll have typically one primary mentor. And so from mentoring block to mentoring block, each mentor will do a handoff kind of to say, here are the things that this resident is working on. Here's the things that are going really well. We want to keep fostering that. And then here are some areas of growth or opportunity we've identified. How do we help foster the resident in those areas of growth and then just continue to facilitate their success? In the bottom part, you'll see the teaching, where the bulk of teaching is going to happen in our fall and summer trimesters. And this is just a general overview, general sample schedule. Things will obviously change from time to time, but just to give you an idea. So as you can see, most of your time will be spent in patient care. We have one day identified for mentoring a week in acute care. Um, while we have the whole day blocked, it's not expected that you're doing mentoring that entire day one-to-one, but knowing that acute care is a little bit more dynamic and you won't know what your caseload is until that morning, um, you will sort of have to select your mentoring patients that day, but having a general idea of what your goals are. But the mentoring time is going to be self-directed by the resident. So you will have a mentor with you the whole day. And the aim is to identify those mentoring goals, patients that you've been working with, and you'll get coached on how to most optimally use that time as well. And then on Fridays, it won't be every Friday, but that's where the teaching occurs. And then we try to keep didactics on a consistent day each week. When you're on your acute care rotation, there'll be a one weekend day per month, and potentially a holiday commitment during your acute care rotation. And for outpatient, again, you have primarily patient care throughout the week. Your mentoring block time will be a little bit more specific. Again, this is outpatient, so you will have the opportunity to schedule the specific patients that you want mentoring on in those time slots. So the resident, is self-directing again, which of these patients they want mentoring on, what are their specific goals, what are their clinical questions, and using the mentor to facilitate those. Thursday afternoons in outpatient are also times for lunch meetings, department meetings, and then journal club and in services as well. So some additional residency year opportunities. You'll have weekly meetings with the program director or coordinator, depending on the site. And whatever of the director or coordinator of the site you're not at is who will be checking in with you on a weekly basis. And so that way you just have kind of a somebody who's a little bit removed from the situation too. So there's a safe space to kind of share what's going on in the day to day, and provide that support. And in these weekly meetings, we're kind of checking in like how things are going, how are you feeling about everything, what has gone well during your week, what are things that you're hoping to focus on for the next week, keeping tab on just like mentoring goals overall, keeping tabs on overall residency, just obligations throughout the year. And this is also a chance to give some feedback around, how is mentoring going? How is the program going overall? Because we greatly appreciate that feedback from the residents because that's what helps our program get better. The residents will also have opportunities again to teach in a variety of the TPT courses with our UCSF SFSU DPT program. So we'll be teaching within lectures and labs in PT 710, 213, and 700. And so these are intro neuro classes, are a little more advanced neuro classes, and then teaching some labs for neuro and acute care as well. Residents are also required to present in services throughout the year. So you'll be presenting a host of journal clubs, M&Ms, and complex case presentations. So each resident will be responsible for presenting several of these on their own. And then you will also have the opportunity to listen in and participate in your co-residence presentations as well as residents from other residencies. There's a requirement to participate in grand rounds, and we have a whole host of grand rounds throughout UCSF offered by multiple departments, including neurology, neurovascular, neurosurgery, general medicine. Every major department has their own grand rounds, so you have access to those as a learning opportunity. There are also department in services within the PT, OT, and speech departments in inpatient and outpatient. Each resident will also be required to do a quality improvement project throughout the year. And this is something that we start to talk about in early fall with an aim of completing throughout the year. This project is done in conjunction with one of our faculty members, Matt Miller, who is a PhD. And so he facilitates the program management aspect of it. And then we will also have you identify a clinical point person just to help with institutional knowledge, general clinical challenges, or perspective within the organization as well. And then the aim of this is presenting at our UCSF Health Quality Improvement Symposium, which is a large, I would say, one-day symposium where there's posters from every single discipline you can imagine at UCSF. And so it's a really cool interdisciplinary experience, and you get to see what kind of work is being done all over the organization. And then you are also to submit an abstract to CSM. And then right around graduation, we have a resident QI symposium where all of the residents present their work in a platform style presentation. Each resident will also be a CI for 1 to 2 day students, so another opportunity for teaching, and then additionally some experience in those specialty clinics, which we highlighted earlier. Some of our didactic modules, we add stuff every year, which I think is a strength of our program. The ones highlighted in yellow are shared courses between all the residents, all the residency programs. So you get an opportunity to meet with your fellow residents in our ortho, acute care, and women's health residencies. Our faculty, so we have over 10 neurologic clinical specialists on our faculty. 5 of our faculty members have completed neurologic residencies, and 13 of our residency faculty also teach concurrently in the UCSF SFSU graduate program in physical therapy. One of the strengths of our program, too, is we do specifically focus on ongoing residency faculty development. We identify that it is very different to mentor a resident than it is to teach a student or be a CI for a student. So we continue to foster those skills so we can be the best mentors we can to our residents. Some other unique features. So again, our mission is to enhance the skills as a neurologic clinical specialist and a clinical educator. So we really focus on the role of a lab instructor and lecturer within our DPT neuro curriculum. You'll get a chance to get feedback from students and course director. You have in the beginning of your resident year, specific courses and some mentoring in general residency curriculum to enhance your teaching. So we will teach you how to teach, which is an important skill set as well. You get the opportunity to be a CI for a 1 day DPT student, and then there's also additional teaching and volunteering opportunities within the community. So our deadlines, our application RFP CAS opened up on October 1st. The deadline for submission of application and all materials is by February 15th. Applications will include a CV, a personal statement, 3 letters of reference, 2 from PTs, 1 from somebody academic, and can speak to your just schoolwork and in your DPT program, and then just your graduate academic transcripts. Some requirements: you must be a graduate of a CAPD accredited physical therapy program or currently enrolled in a good standing program. Proof of licensure or PTLA status by the Physical Therapy California Board. Allison Scheid highlighted earlier, if you have the capability and flexibility of taking the April boards, that can take a big load off. One, it also, if you are coming from out of state, it allows that extra time to make sure that the California license gets processed. If sometimes with the July date, we're going right up to the wire of that start date, so it can just eliminate some of that stress. If you are in a clinical in the spring and then also studying for your boards, that can emulate the rigor of a residency year, so it's good practice in that vein as well. So for application interviews, please don't hesitate to email us at neuroptresidency@ucsf.edu with any questions at all. We'll also have an opportunity coming up right now to answer any questions that you have. Our applications will be reviewed by the end of February, early March, and we will offer interviews. Our interviews will be held virtually with a date at this point set of March 16th, and this will include a discussion panel interview and a clinical case interview as well. Here's some pictures from our residents last year. The posters are at the UCSF Health Improvement Symposium. And then a picture of Anna and Juliana from graduation last year. So now we'll open up to any general questions and a Q&A with our residency alum, Dr. Anna Bergstrom, who graduated last year and started this week as a faculty. So she has gone from resident to colleague. So very pleased to have her here. And I will stop recording, but if you have any questions, please don't hesitate to reach out and email me.